Knocking out women's health issues. Breast cancer. 1 in 8 women in the United States will be diagnosed with breast cancer in her lifetime. Breast cancer is the most commonly diagnosed cancer in women. Breast cancer is the second leading cause of cancer death among women. Each year it is estimated that over 246,660 women in the United States will be diagnosed with breast cancer and more than 40,000 will die. Over 2.8 million breast cancer survivors are alive in the United States today. The cause is still unknown. Some possible risk factors: obesity, a sedentary lifestyle, excessive alcohol consumption, radiation to the chest before the age of 30, combined hormone replacement therapy, as well as several genetic factors. Prevention. While there is nothing that will guarantee 100% prevention, living a healthy lifestyle and going for annual checkups will significantly decrease your chances. Osteoporosis. Fractures from osteoporosis are more common than heart attack, stroke, and breast cancer combined. Over 80% of all fractures in people 50 plus are caused by osteoporosis. Osteoporosis causes 70 to 90% of 30,000 hip fractures annually. The most common sites of osteoporotic fracture are the wrist, spine, shoulder, and hip. Women and men alike begin to lose bone in their mid-30s. As they approach menopause, women lose bone at a greater rate, between 2 to 3% per year. At least 1 in 3 women and 1 in 5 men will suffer from an osteoporotic fracture during their lifetime. Prevention. Beginning a lifelong commitment to exercise and healthy nutrition while you are still young reduces your risk of developing this condition later in life. Also, getting enough calcium. Depression. Women are twice as likely to have depression and symptoms of depression as men of the same age. 12% of all women in the United States will experience symptoms of clinical depression at some point in their lives. Approximately 1 in 10 women experience symptoms of depression in the weeks after having a baby. About 50% of all adults experiencing symptoms of depression will not talk to a doctor or seek help for depression. Risk factors: family history, childhood experience, alcohol, stress, physical illness, and medications are just to name a few. Prevention. While there is nothing that can prevent someone from being depressed, there are steps to take if you are feeling depressed. Consulting a doctor, therapist, or talking to family members and friends. Autoimmune disease. Autoimmune disease is one of the top 10 leading causes of death in female children and women in all age groups up to 64 years of age. Researchers have identified 80 to 100 different autoimmune diseases and suspect at least 40 additional diseases of having an autoimmune basis. These diseases are chronic and can be life-threatening. NIH estimates up to 23.5 million Americans have an autoimmune disease. In comparison, cancer affects up to 9 million and heart disease up to 22 million. Many autoimmune diseases disproportionately affect women, such as rheumatoid arthritis, multiple sclerosis, and systematic lupus erythematosus. Risk factors: family history, exposure to environmental agents, previous infections, and gender, most likely female. Prevention. While the cause for autoimmune disease is still unknown, taking precautions to avoid infections can be crucial. Be sure to wash your hands, try to avoid others who are sick, and stay as active and healthy as you can. Pregnancy. Eating healthy and staying active while pregnant will greatly increase your chances of having an easier pregnancy and smoother delivery. Staying active can protect your emotional health. Pregnant women who exercise seem to have better self-esteem and a lower risk of depression and anxiety. Don't exercise on your back after the first trimester. This can put too much pressure on an important vein and limit blood flow to the baby. Avoid jerky, bouncing, and high-impact movements. Connective tissues stretch much more easily during pregnancy, so these types of movements put you at risk for joint injury. Menopause. The average age of onset in the United States is 51, according to the Mayo Clinic, which defines menopause as 12 months after your last period. At that point, you're no longer fertile. A study of menopausal women revealed that 80% experience no change in quality of life. Many women begin to lose bone density after menopause. Estrogen provides some protection from heart and blood vessel diseases. Heart disease is the #1 killer of women. Dealing with symptoms. Hot flashes. It's a good idea to dress in layers so you can quickly take off a layer and put it back on when you cool off. Acupuncture and yoga may also help relieve hot flashes. Vaginal discomfort. Over-the-counter vaginal lubricants might be able to help. Perform some pelvic floor muscle exercises, Kegels, if the problem continues. Prescription medications may be able to help. Sleep disturbances. Avoid caffeine and alcohol. Get a little exercise each day. Keep your bedroom at a cool temperature. Heart disease. About 610,000 people die of heart disease in the United States every year. That's 1 in every 4 deaths. Heart disease is the leading cause of death for both women and men. About 47% of sudden cardiac deaths occur outside a hospital. This suggests that many people with heart disease don't act on early warning signs. While some women have no symptoms of heart disease, others may experience heavy, sharp chest pain or discomfort, pain in the neck, jaw, or throat, or pain in the upper abdomen or back. Risk factors: family history, poor diet, excessive alcohol use, inactivity, high blood pressure, overweight or obesity, diabetes, high LDL cholesterol. Prevention: a healthy diet, regular exercise, smoke-free, limit alcohol use, and know your family history. Body image and eating disorders. Every 62 minutes, at least one person dies as a direct result from an eating disorder. Eating disorders have the highest mortality rate of any mental illness. 13% of women over 50 engage in eating disorder behaviors. 7 in 10 girls believe that they are not good enough or do not measure up in some way, including their looks, performance in school, and relationships. 80% of 10-year-old girls have dieted. 90% of high school junior and senior women diet regularly. Young girls are more afraid of becoming fat than they are of nuclear war, cancer, or losing their parents. Girls' self-esteem peaks when they are 9 years old, and hormones, peer pressure do a number on girls' confidence. Risk factors: family history of mental illness, media, and peer pressure. Prevention and treatment: education programs to create awareness, creating more open discussion, consulting a specialist, nutritional counseling, group family therapy, writing in a journal, or finding a hobby or activity you enjoy.